IOP stands for Intensive Outpatient Program. It means that somebody needs a little bit higher level of care than going to see a therapist once a week.
We have 3 separate programs. We have a preteen, a teen, and a young adult, usually an after-school program for youth that are in school, or for young adults, it's a day program for 3 hours a day.
If you think about the age of the young adults, 18 to 25, a lot of fear about the future and a lot of pressure from the outside world, especially if you have anything already happening in your life where maybe you're having anxiety or depression or anything like that, and then life changes so drastically. And for the young adults, it's more of a, all right, what am I gonna do next? Let me kind of get my stuff together and then move forward.
I mean, most people think of therapy. You're in a room with a therapist, you're on a couch, and you're talking, right? And that's individual therapy. And what ours looks like is not sitting in a room with one person. It's taking that and expanding that to different modalities. So meaning you're gonna have family therapy where maybe your parents, maybe even your siblings are in the room with a therapist. And then you have 2 therapists in your group that are facilitating a group experience with other peers that are dealing with similar issues. You're in a group with people that are developmentally around you, and you're being exposed to different therapists, different styles, different modalities, all these different things that then you leave with this skill set, but also this breadth of experience.
So when you're in a group setting with peers your same age, sometimes we've even had kids say to us, I didn't say anything for the first few weeks, but I got so much out of it because other people around me were talking about what was going on for them.
When you're working with a therapist, you'll work with someone on what is clicking, what isn't clicking, what feels good, what doesn't feel good. And if you really have no idea what you might want in therapy, we get to figure out how to make it exactly right for you. And so it's a great resource for someone who needs some help getting back on their feet. This could be someone who might be dealing with self-harm, someone whose anxiety makes it really hard to function, or someone's depression makes it really hard to function. The IOP offers that next step up for more frequent and more intensive services.
If maybe half of your problems are stemming from the relationships at home or just the environment at home, there's going to be a big discrepancy in what could be done and what is being done. And so I think that engages commitment to taking the entire family unit in is so cool. And also for the young adults especially, it gives them an element of control. Just reach out. We're absolutely so always happy to help.